So even though we have a surge in mental health awareness and people are more aware of the need, there are still some barriers that prevent people from getting what they need. One thing is there is, for a lot of people, still an unwillingness to talk about mental health issues. And then with suicide specifically, a lot of times there's shame tied to that topic. So that is a further impediment to being able to openly communicate about it. There are several key factors that contribute to suicidal thoughts. One is the factor of feeling like you're a burden to other people or that you don't fit in. Another factor that influences suicidal thinking and suicidal thoughts is the idea that there might not be a way for this pain to stop, kind of a hopelessness about how the pain can stop. And the third thing is having access to lethal means, having access to a way to harm oneself. There are several metrics that are very hard to hear and to face about how there is a lack of access to care for a variety of reasons for people to access mental health care, and that people are suffering. And it's a multifaceted issue as to why that is and what the different barriers are. For one thing, there aren't enough therapists and counselors to serve the amount of need that there is. A lot of times people don't know what types of services they need. They don't know how much it will cost. They don't know how to access it. They don't know how to search for it, and they may not be able to afford it. And then there are cases where all of those things are fine, but they might be in a community where there just aren't enough providers to adequately meet the need. Insurance is another barrier that we know prevents some people from getting mental health care. So that insurance is a barrier. Many people are uninsured or underinsured, and unfortunately a lot of insurance plans don't even cover mental health services, or at least not the kind that they would need. And then unfortunately, but for some very valid reasons, a lot of therapists don't take insurance. So insurance can also be a problem for people to get the access that they need. Refuge from the very beginning has been dedicated to meeting people in that gap. We also don't accept insurance, but we do offer a sliding scale fee based on income. So many of our clients pay as low as $25 for the services. And every one of our clients is matched with the best therapist for their needs. And that is not based on income, and it is not based on the fee that they pay. We match people with who they need to see, but their fee can be based on their income. But for some people, even the lowest fee that we offer of $25 can be a barrier. Some people can't afford that much. We also have partnerships with several agencies who can sometimes cover the cost of counseling if necessary. And we also offer a financial hardship to further reduce the fee in some cases when that's necessary or helpful. We have several initiatives in the state of Tennessee, in Williamson County, and in Franklin specifically, to help reduce the stigma of mental health and to make it more accessible to everyone. Some of those are, we have Find Hope Franklin. Find Hope Franklin is a community-based resource. Their mission is to reduce the stigma associated with mental health care and to provide resources for people to get the help that they need. And then I mentioned having access to lethal means. So there's means restriction, and so there are certain projects and initiatives that go to means restriction to help restrict access to those lethal means. The Natchez Trace Bridge Barrier Project is one of those. They convened in 2018 to try to prevent the suicides that would occur at the Natchez Trace Bridge. That had been the site for numerous suicides over the years. And so in August of last year, they did put up a barrier there to help reduce access to that. So that would be one method of reducing access to lethal means. Suicide prevention training always involves a discussion about reducing access to lethal means. And another important discussion in that category is access to firearms. In Tennessee in 2020, 58.7% of all firearm deaths were suicide, and 61.2% of all suicides involved firearms. So it's an important piece of the conversation, is how do we reduce access to that. At a state level, we have introduced crisis stabilization units, not we at Refuge, but the state of Tennessee. So we have 8 of those, and more of them are on the way. A crisis stabilization unit offers 24/7, 365 intensive short-term stabilization stays for someone who's experiencing mental health crisis. Here at the Refuge Center specifically, we are a part of the nationwide Zero Suicide Initiative. So we have a Zero Suicide Task Force, and what that is, it's a method to assess and implement suicide care to help us provide safer suicide care for people who are in that space, in that crisis mode. So here at Refuge, senior leadership prioritizes trainings, organization level trainings, community trainings, awareness, community engagement, and ensures that we have systems in place for all of our staff to be well trained and constantly trained on assessing for suicide and treating our clients for that, and then support for the therapists as well as they meet their clients in that space.